Today, I'm welcoming back Grace Emily Stark, editor of Natural Womanhood and one of the leading voices advocating for restorative reproductive medicine. You may remember Grace from our earlier conversation on the pitfalls of contraceptives. If not, go and check out that episode from season 2 after this one. Today, we are diving deeper into what's broken in the current model of fertility treatment and why restoring the body's natural function rather than overriding it may be the most promising path forward. We will talk about the science, the politics, and the cultural narratives that make it so hard for this approach to get a seat at the table. Is IVF really the only option? Why aren't women being told about other methods? And what might a more humane vision of reproductive medicine actually look like? Let's find out. Grace, welcome back to Brave New Us.
It's so good to be back with you, Samantha.
So, for those new to the concept, what is restorative reproductive medicine? How is it different from conventional gynecology or fertility treatments like IVF?
That's a really great question and a really good place to start, especially because we're seeing a lot of misinformation out there about what restorative reproductive medicine or RRM actually is. So, the conventional approach when it comes to gynecology, we'll start there, is to suppress issues that women have with their reproductive health. So, key among that is birth control. Birth control is probably the number one tool in conventional gynecology's toolkit for addressing reproductive health issues. And mainly what it does is it functions to shut down a woman's cycle. And so when you're having cycle issues, if you just shut down the cycle, the logic goes, no more cycle issues, right? So that's why women with painful periods, teen girls with painful periods, are often put on hormonal birth control because it completely just shuts down their cycle. They still bleed because they're taking a sugar pill 1 week out of the month, but it's not a true period. And so a lot of women find that that does sometimes do a decent job of suppressing symptoms. But what restorative reproductive medicine understands and what practitioners of RRM understand is that that's not getting to the root cause of why women are experiencing infertility. So we know in this country that endometriosis takes on average about 8 to 10 years to get a proper diagnosis. And that's insane because it's actually as common as diabetes. Like,
Mm.
and it's often one of the underlying issues causing, or sorry, the underlying issue causing painful periods in a lot of women. So are fibroids. And so a restorative reproductive medicine practitioner would see a woman coming in and would say, okay, let's get to the root of this. Let's start doing some imaging studies. Let's start doing some hormonal draws, blood draws to test your hormones. But first and foremost, they're going to get you charting your cycle. They're going to get you in touch with what your cycle currently looks like, teach you the biomarkers of your fertility so that you can read the signs of your cycle, so that you can track it. And then a restorative reproductive medicine trained practitioner can use your chart as a fifth vital sign and use that to help diagnose whatever underlying conditions are causing your painful periods, causing your infertility, whatever issue that you're presenting your doctor with. So rather than bypass issues or suppress issues with reproductive health, RRM gets to the root cause and actually addresses those underlying issues that are causing you to have the symptoms that are disrupting your life or causing you to deal with infertility.
Yeah. Why does it take so long for a diagnosis? Why does it take a decade to get that answer?
Medical school students are taught, especially those going into obstetrics and gynecology, are taught that the birth control pill is the best tool in their toolkit. And it's kind of that perennial problem of when the only tool you have is a hammer, every problem looks like a nail. And so it's kind of just taking a hammer to women's health issues, just to prescribe birth control for whatever issue your female patient presents with in obstetrics. The second issue is also that we don't have enough funding. We don't have enough research around it, which is crazy for how common it is. There's a real lack of research into it, and so there's a lack of education about it in
Mhm.
medical school and in residency training. And so there's this constellation of symptoms that doctors just don't know about because they weren't taught about it.
Mhm.
Because unless you really specialize, like by going into restorative reproductive medicine,
Mhm.
you're probably just learning like, oh, endometriosis is this painful period condition, and the best thing we have is birth control.
Yeah,
So,
that was me. I started my cycle when I was 10.
mhm,
I got put on the pill when I was 13,
mhm.
because it was so painful, like, I couldn't go to school, and then I tried a bunch of different things, like, I was on the patch, and that gave me rashes, and then one type I think they were giving me narcotics at one point.
I'm so sorry.
Finally yeah. Yeah, it was rough, but, I got off of it when I was in college, and I would still have to miss a day or 2 of classes every month, which was fine because I was, like, a fairly good student, but when I started working, that didn't work, so I went back on it, and then I got a clot, and yeah, anyway,
Right, right.
all the fun things about contraceptives, it's like, this is not the solution that women need.
Yeah.
Um so when we're talking about this approach, it seems like there's an underlying philosophy that's driving this approach that makes it just entirely different from the outset from mainstream medicine. Do
Yeah.
you think it's a scientific, ethical, holistic, or some combination of all of that? How would you describe that?
Absolutely, some combination. I think the central premise that undergirds all of restorative reproductive medicine is that a woman's cycle is an essential function of her body. I mean, when we say it's a fifth vital sign, we really mean it, um, because it's both impacted by every other aspect of her health and impacts every other aspect of her health. It is totally inseparable from your health as a woman. You know, you and I are of the age where I'm sure we can remember the commercials on TV that were like, you don't need a period. If you're on birth
Mhm.
control, did you know there's no medical reason to have a period? Blah, blah, blah. And so we were raised on that, right? That, oh, it's just this thing that we can shut off. It's this inconvenient thing that we can shut off. And why wouldn't we if we have the option to? And it's a lie. It's all been just an incredible lie, um, because it's part and parcel of our health as women to have a healthy functioning cycle. And that's probably why birth control has so many, like, far-ranging side effects and why women are so blindsided by it because they're like, "Well, I'm on birth control and my stomach hurts all the time, but what on earth could birth control be doing to my stomach?" And or, "I know that birth control, might give me a clot, but I don't really understand why, and I also know it's associated with depression, and I don't really understand why." And it's like, there's all these disparate side effects, both because of what birth control is doing to our body and because of what it's stopping our body from doing, which is I think is the real key that a lot of women don't understand is that birth control is as dangerous for what it's stopping your body from doing, which is cycling
Mhm.
and primarily ovulating, right? Ovulation is the main event, we say, of your cycle. We think of the period as like the main event because that's all we're taught about is just to look out for your period once a month. But really, it's ovulation we need to be taught to track and keep tabs on the biomarkers of because it's healthy, regular ovulation that, particularly in the teen years and early 20s, that helps proper brain development happen in women, proper bone density
Mhm.
building and development happen in women. It has implications for our heart health, how our cardiac tissue develops and functions, our immune system, especially in different tissues like cervical tissue, breast tissue, which again is why we see the correlation with breast cancer.
Mhm.
So, to be able to develop and function properly as women, we need to have regular healthy cycles. And so, if you're not having a regular healthy cycle, We need to get you cycling healthily and regularly, not just because it'll improve your quality of life and that your periods won't you won't feel like your period's trying to kill you every month, but also because we need to make sure that your hormones are doing what they're supposed to do all across your body, not just when it comes to your bleeding. So that's why we call it the fifth vital sign. That's why restorative reproductive medicine is just so fundamentally, like foundationally different from the conventional approach. Restorative reproductive medicine that undergirds everything that a healthcare professional trained in RRM does, is restoring the cycle so that you have good health, good overall health, and with it, good fertility too.
How do you know when you're walking into your doctor's office or making an appointment, I guess? How do you find one of these doctors who is practicing restorative reproductive medicine as opposed to the more conventional approach? How do you know that not going to get in your doctor's office, sit down, and then have them look at you like you're a crazy person?
Yeah, that's a good question. Sometimes you do just have to go to the appointment and see. I think unless they bill themselves as like a holistic practitioner or somebody who's specifically trained in naprotechnology, fem, or now neo-fertility is another growing contingent of kind of this flavor of medicine. Unless they specifically bill that they're trained in that, you're probably going to be met with someone who is likely to offer you birth control, or if you're trying to get pregnant and not getting pregnant successfully, IVF, especially if you've been trying for 6 months to a year. But I also would encourage women, if you have an OBGYN that you have used and that you've liked, you might be able to educate them a little bit. We offer a lot of resources at Natural Womanhood. I know that we have readers who have printed out articles and brought them to their doctors. We need more doctors to become aware that this is a legitimate and effective form of practicing medicine. So I wouldn't necessarily like write your doctor off or write any doctor off if you don't see automatically that they practice this way, if they don't bill themselves as practicing that way. Definitely, if you know that you have issues and you're not in the place of wanting to have to educate your doctor, you need help.
Yeah, if
Um,
you were a decade in, like, by the
yes,
time I got surgery for endometriosis, I was married. So it was 11 years for me.
yeah. So go to somebody who says that they are a restorative reproductive medicine trained healthcare practitioner, especially if you see that they're trained in naprotechnology or fem, that's FEMM, or neo fertility, NEO fertility,
I
right?
will say I saw doctor after doctor, about my issues, and then when I went and I finally saw the doctor, who was a NAPRO
Hmm.
specialist,
Hmm.
she diagnosed me on the first visit, and
Yeah.
then my next interaction with her was having surgery, and the problem was fixed. So,
Yeah. Yeah. I mean, it's
that 11
incredible.
years versus 1 visit is a little bit more efficient.
Yeah, and that can give you whiplash, right? And so many women get so fired up and so angry, that this was a solution that could have, saved them years of pain,
Yeah.
years of interventions that they didn't want. Um, and for a lot of women, like years of heartbreak from miscarriage and infertility.
Mm,
And so I think it's great that we're seeing more people gain awareness that restorative reproductive medicine exists and that they're demanding it,
mm,
because the demand is going to cause is ultimately, I believe, what's going to cause more doctors and med school students and residents to want to learn more
mm,
about it. And the thing is they might come into it with these preconceived notions. Like I can tell you so many stories of women who go to their doctor who are like, "That's not medicine. That's not
yeah,
science. Um, isn't that? Aren't you just talking about the rhythm method? That's
yeah.
that's not science. Or you're just going to get pregnant, or IVF is all that we can do for you for infertility. What are you talking about? go see it, some woo-woo person if you want.
Mhm.
Like, they think it's they think that, this just is, like, this ideological, non-scientific unscientific, kinda like Reiki and crystals and woo-woo type of thing.
Mhm.
But the more that they actually start to read about it and
Yeah.
dive into it, like, you can't but not see that this is based in science, and it's actually based in better science than most of what conventional gynecology does, because it's based in a really profound understanding of the female menstrual cycle that should be the basis for all of gynecology, right? Like, it would just seem like that would just make sense, but unfortunately it's not. But what restorative reproductive medicine is ultimately based in is this really keen understanding of what a normal, healthy female menstrual cycle should look like. And that's why it goes hand in hand with fertility awareness methods, and good body literacy in women and patients.
Mm. So we talked about like lack of awareness in medical school, lack of education, lack of understanding, masking problems with the pill, or just you have this any one of these female symptoms, the solution is the pill, period, end of story. Those are some of the problems to
Mhm.
this being more widespread, understood, and implemented. Are there other barriers or are there policy barriers to wider adoption of restorative reproductive medicine right now?
Yeah, I think so. On the cultural front, there's definitely bias against
Okay.
it, and I think a lot of it stems from, frankly, I think there's a good, not all of it, but a good proportion of the bias stems from anti-Catholic bias,
Mm,
because Catholic physicians are the pioneers of restorative reproductive medicine, and that's because when the Pope said, birth control is off the table for Catholics,
mm,
back when Humanae Vitae in whatever year, 1960,
60.
was published. That kind of lit a fire under Catholic physicians to start looking deeper into the female menstrual cycle and into different issues around female fertility. The rhythm method was actually already a thing by this point. I think that had been around since the 50s. And so Catholics were already kind of starting to delve a little bit deeper into female fertility, for the understanding that it could help couples with family planning in a way that was licit according to the tenets of the Catholic Church. And so I think a lot of people see it as like, oh, fertility awareness is just Catholic birth
Mm,
control, and restorative reproductive medicine is just Catholic IVF. I've heard people refer
mm,
to it that way. And it stems from the fact that Catholics really grew up and pioneered this form of medicine. And it's like that necessity is the mother of invention idea,
mhm,
where Catholics were not allowed to use birth control. So, but they were allowed to use periodic abstinence. And
mm,
so that's where the idea of natural family planning, so using fertility awareness to understand when you're fertile and when you're not, and having sex when you're not fertile, avoiding sex when you are, if you're trying to avoid pregnancy, was illicit means of family planning.
mhm,
So that's where those methods grew up. And along with it, a really good understanding of the female cycle and fertility. And then from kind of the Catholic prohibition against in vitro fertilization, and going hand in hand with this really good understanding of what female fertility looks like, grew up these restorative reproductive medicine techniques that really looked at, okay, well, we're not going to use IVF, but do we actually even need to? Because I
mm,
can see from your charts, I can see from your cycles that they don't look right. That tells me
mm,
that there's something wrong with your fertility. And so Dr. Hilgers at Creighton University started doing deep dives into different hormonal balancing, different surgical techniques that could be done to restore fertility. And so because a lot of this was pioneered by Catholics, again, out of necessity,
mhm,
um, I think there's a lot of anti-Catholic bias that comes along with it,
mm,
even though now there are RRM professionals of all different religious stripes, all different
Mhm.
backgrounds, because as people understand, like, oh no, this is just good medicine. This isn't Catholic
Yeah.
this or Catholic that. This is just, if you're a woman with, a cycle, we can understand what your body's doing or what it's not doing, and treat you better with that understanding.
Mhm.
And so I think part of it is an anti-Catholic bias that still persists today. And then on the policy side of things, insurance will not reimburse for a
Mhm.
lot of what RRM does. IVF, the IVF industry has made a lot of inroads in
Mm.
getting coverage mandated in certain states, and we haven't seen the same push previously with RRM, although that's now changing. Arkansas signed the Restore Act
Mm.
several months ago, and now, in addition to insurers in Arkansas having to cover IVF, they also have to cover RRM techniques to treat infertility. And also under Title 10, they have to implement in clinics that receive Title 10 funding, have to also offer fertility awareness-based methods alongside any other family planning information that they give out. So that's a huge step forward, and we
Yeah.
we would love to see there's a push to implement that on the federal level as well.
Mm.
And so there's change happening even as we speak, and that's super exciting. But we're really far behind IVF industry, which is it's a David and Goliath. IVF has all the money, and they have all or most of the influence. And so they've been able to really wield that in terms of what gets coverage. And so I interviewed Dr. Patrick Young. He owns the Restore Center for Endometriosis in St. Louis, I believe it is, who's doing some absolutely incredible things with endometriosis surgery in particular. He does surgeries that last 8, 9, 10 hours.
Mm.
He told me his longest surgery, I think he just did, was 13 hours, and he would get no reimbursement for that from insurance. And so he's cash pay. And unfortunately, a lot of these clinics and a lot of these RRM professionals have gone to cash pay, which is unfortunate because it means that a lot of people can't afford their care.
Right.
But if we were able to see better coverage from insurance, perhaps more of these professionals would start accepting insurance, and more women would be eligible for this kind of care. Because, I mean, someone like Dr. Young, and there are other doctors, but I'll use him as an example because I recently interviewed him on the Natural Womanhood podcast. He goes in to women's bodies and will remove endometriosis from that's covering their bowels, that's covering their ovaries, that's locking all of their pelvic organs together. And these pictures are wild. I mean, if you have a strong stomach and you want to see
I don't.
what extensive stage 4,
My husband does. He would be really interested.
I mean, just if you can stomach it, if you Google search like stage 4 endometriosis
Yeah.
photos, it is crazy. I mean, it's just masses of scar tissue literally locking all of your pelvic organs together. And so he will go in, Dr. Young and other well-trained RRM practitioners will go in and cut all of that out.
Mm.
And then also they have techniques to prevent scar tissue from forming after
Mm.
the cutting out, the excising of the endometriosis lesions. And so that's why the surgeries he's doing are lasting several hours.
Mhm.
And he gets patients like this one who was a 13-hour surgery that no other physician will touch.
Mm.
He told me that this particular patient was a peek and shriek, where the prior endometriosis or prior OBGYN who said they'd do surgery on her literally poked the laparoscopic camera in and just pulled it right back out and was like, we can't do anything for this.
Mm.
And he recommended, I think, like a total hysterectomy. And this is, I think, a woman in her 20s, and said, you're just gonna we're just have to take all this out, and you're gonna have to be on birth control for the rest of your life
Mm.
to suppress it. And thankfully she heard about Dr. Young and got on his list, and her whole life, she's been given her life back, her life and her fertility. back.
Mm.
So this is the kind of life-changing, just cutting edge stuff that things like Dr. Young, Dr. Naomi Whitaker, there's another Blaise Milburn up in Pittsburgh, Dr. Kongawasa in Atlanta, these doctors that are really, really specializing in really fine-tuning their endometriosis surgery techniques are doing incredible stuff. But yeah, a lot of them are cash pay because insurance won't cover it, which is really sad and hopefully will change.
Yeah. Yeah. So two things about that. One, it just strikes me so much because follow the science should mean follow the science and whatever the best science, techniques, medicines to solve the problem. And you shouldn't depend on the character or creed of the scientist who's doing the work.
Right.
So the anti-Catholic bias. But I understand how that plays into people's perceptions. You can't really
Mhm.
separate out your biases.
Yeah.
Recognize them. Maybe you can choose to do better. But then the other thing that strikes me as I'm listening to you talk is I just had a conversation with Dr. Richard Burt about he has this technique using your own blood stem cells
Mhm.
to not cure because your genetics are the same, but reverse autoimmune disease. So you take
Wow.
the sample from the patient and you do this conditioning regimen to wipe the immune system clean. But basically, because it's not a drug, it's the patient's own
Mhm.
biological material. There's
Mhm.
no FDA approval because it's blood. Like you can't patent blood. So there's not
Interesting.
awareness. And the first one that he was able to reverse was multiple sclerosis, MS, which is, steals people's lives from
Oh,
them.
that runs in my family. Yeah. I'm
Yeah.
very familiar with it.
And
Wow.
but the patients, like the pharma, the medication, it's $60,000 in infusion,
Yeah.
$90,000, and it doesn't even improve quality of life. So that's the kind of money that's up and for
Yeah.
the medications that do not solve the problem for these patients. They maybe
Yeah.
keep the condition from getting worse, like slow the progression. Meanwhile, there's a doctor who has figured out how to reverse and give people their lives back, but there's no money. There's not a company that's going to get rich off of it. They're going to get
Yeah.
rich off of people staying sick. It's just this
Yeah.
problem with the
Yeah.
symptom, which seems like it's the same thing here, or not the same thing, but just a similar aspect of the problems with the system that really disincentivize medicine from addressing patient problems in a way that restores them to full health because healthy patients are not profitable.
Yeah, well, the Dr. Young likes to say, like, I'm a one and done surgeon." He's like,
Mm.
I wanna do surgery on you exactly one time and
That's,
never again."
that's exactly what Dr. Burr said in the interview and in his book Everyday Miracles about same thing. I want to make the problem we deal
Like,
with
God
one
God
time gone.
bless those doctors, right? They
Right?
still they still exist.
And then for trying to practice medicine that way, they get laughed off as voodoo doctors. Like, "Oh,
Right.
we couldn't possibly actually address these issues. We're just
Yeah.
gonna give them a pill to make people go, go away,
Right, and you just
didn't
keep
care,
coming back
come
for
back."
more, right? And that's it with IVF too, is it's like,
Mhm.
"Okay, we're gonna get you your first baby and maybe, and then if you want another one, then you're coming back and doing more cycles with us." And, rather than, "Let's get you healthy, let's balance your hormones, let's get whatever surgical interventions we need going for you," in the hopes that you yourself will be able to get yourself pregnant. Well, with your spouse, of course. But, with
Well,
no
they're working on it.
assistance.
They're working on the science to make it so
They
that
are
they
working on
can
that.
be the
That's a subject for another
spouse.
podcast,
It
but
is. Actually, Emma Waters and I did talk about that briefly in the
yeah,
we had.
she's a good one to talk to about that.
If you could wave a magic wand and pass 3 laws tomorrow, what would be on your policy wish list?
Well, laws, I don't know.
Okay,
Um,
changes to the system.
but yeah, changes to the system, I would like to see a complete and total overhaul, first and foremost, of what we call sex education in this
Mhm.
country, because it's a joke. It's condoms on bananas. And so young women and young men reach adulthood learning absolutely nothing about their bodies and without actually even really learning about, they're taught about all the different methods of contraception and sex ed, but they're not actually really taught how they work. And so we just have this ridiculous lack of education in our country for people. We keep people illiterate of their bodies. And so I would like to see actual true body literacy happen. And in addition to that, and maybe I should explain a little bit more what I mean by that. I would like both young women and young men to understand the female menstrual cycle. I would like actual legitimate puberty education for young men and young women, whether it's done on a public education level or private education level. I would just like to see an expansion of body literacy
Mm.
program so that when ideally before girls and boys are going through puberty, they have the context for why it's happening and know when it's happening and what it's all geared towards, which is good and healthy
Mm.
fertility and therefore good and healthy, like, just overall health. And I'd like to see gosh, it's like I wish I don't wanna just pull a number out of my hat, but there's a really huge proportion of young girls who have no idea what's happening to them when they start
Mm.
their first period. A lot of them think they're dying or that they're going to die. And as the mom of 3 daughters, like, I hate the idea that any young girl would start bleeding and have absolutely no idea why. We had someone on our team at no, Natural Womanhood who thought she had cancer when she was like 11 or
Mm.
12. She Googled it when she first started bleeding and carried that around with her for several months, thought she was dying of cancer. And that's like a heartbreaking reality that I would love no young woman to ever experience, ever. I would
Yeah.
like her to know why she's bleeding, and I would like her to know that it's a good and healthy and powerful sign of her body doing what it's supposed to.
Yeah.
Um, and I would like her mother to understand that if she's not bleeding, properly, if she's bleeding too much, if she's having
Mm.
too much pain with her periods, or, insane mood swings with her periods outside the norm, or any of the constellation of issues that young women can have with their cycles. I want their moms to know that there are doctors that they can take their daughters to who will not just put them on birth control,
Yeah.
who won't just tell them that, if you unless you want her to miss school all the time, this is what you need to do. And so, yeah, just on a very broad population level, I would like to see better education and better understanding, better body literacy, and particularly around the female menstrual cycle and the fact that it is this fifth vital sign. I'd also like to see this is a really big ask, but I would like to see,
It's a magic wand, so you're good.
magical. That's
Yeah.
right.
You may pick as
I
you
would
want.
like to see people stop referring to, IVF as infertility treatment.
Mm.
I would wipe that out of the lexicon because it does not treat infertility at
Right.
all. It works around whatever issue is causing your infertility.
Mm.
Um, even when it's biologically, unnecessary, I'll put that in quotes because it's not necessary for anybody to ever have a
Mm.
baby, but there are some really unique conditions, like, there's a complication of being a male cystic fibrosis gene carrier, so you don't actually have cystic fibrosis yourself, but you
Yeah.
carry the gene. Men who have that, one of the rare complications of that is they don't have vas deferens.
Oh,
And so, yeah, so they're shooting blanks,
yeah.
as they say. Um, we can't grow vas deferens yet.
Yeah.
Until we can, yes, IVF is one of the only way that you're going to have, a biological child of your own, right? There's gonna be has to be some kind of medical intervention to get the sperm out of the testes.
Mhm.
Um And I don't know, I guess you could do artificial insemination.
Yeah.
Um, it wouldn't necessarily have to be IVF, but um, with women too, if you've had your fallopian tubes removed, either because of cancer concerns or because you thought you wanted to be done having babies and you had them taken out, and now it turns out you do want them. Uh, Same kind of thing, right? You're not going to get pregnant without uh, the intervention of IVF. So there are some kind of anatomical issues that, as of right now, restorative reproductive medicine cannot address. Maybe someday we will.
Mhm.
Maybe we'll be able to regrow tubes. Maybe we'll be able to grow vas deferens. But until then, we have to be honest about the limitations of restorative reproductive medicine. But still, even in those really kind of niche cases, you're not treating infertility, right?
Mhm.
By using IVF to address the reason you're not getting pregnant.
Right.
So it's just a complete. It's the same way that birth control for so long we've said it regulates the cycle, right? It doesn't. It shuts it
Yeah.
down. I would like to, if I could wave my magic wand, again, this is magic wand, I would wipe the regulating cycle language around birth control out of the lexicon, and I would wipe out the infertility treatment association with IVF out of,
Can I interrupt you for a second?
yeah.
So you mentioned like those limitations, but I'd
Mhm.
like to go a little bit more into the potential with actually um, treating the maybe we're already going to go into this, but I think there's
Mhm.
more to be said, especially for listeners who are not familiar. What can restorative reproductive medicine do to actually heal underlying causes of infertility that IVF just hijacks the body and circumvents?
Sure, yeah. Thanks. That's a good thing to delve into more deeply. As for endometriosis, the surgical techniques that RRM trained professionals have
Mhm.
blow conventional gynecology out of the water. Never, ever, ever go to a run-of-the-mill gynecologist and let them do endosurgery on you.
Mm.
Don't do it. Most of them will perform ablation, which is just burning the lesions,
Yeah.
which you don't want. And even the ones who will excise some of it won't get all of it because they're not trained to see all of it. Some of it's hard to see, or they won't poke around in there and make sure they're getting it everywhere it is. They'll just, maybe get it off of one ovary in the hopes that you can get that one ovulating again.
Mhm.
They won't get all of it. And they aren't trained to prevent adhesions. And so that's the scar tissue that will form after endometriosis excision surgery if the surgeon isn't trained to prevent them. And that's really common. And it can actually leave you almost worse off than you were prior to having the surgery, if you can believe that. So, someone trained in neofertility, in fem doesn't really do surgery so much, but napro technology,
Mhm.
somebody who is actually trained in those forms of restorative reproductive medicine can go in and get all of the disease, prevent adhesions, and so they can restore normal anatomy
Mhm.
to your organs and your pelvis. That can help your ovaries start ovulating again. They can open up tubes, even tubes that have been blocked or damaged by endometriosis. Dr. Naomi Winokur is a big specialist in this. You can find her on Instagram. She's a huge following on Instagram. She
Right.
in her RRM Academy, she has a lot of videos of her performing these procedures and giving information to doctors who want to learn more, and patients who want to learn more. So don't listen to a doctor who tells you your tubes are blocked. We can't do anything for
Mm.
you. It's IVF or nothing. RRM trained doctors can open your tubes a lot of the time, in addition to removing any endometriosis tissue that's inhibiting your ovaries from functioning properly, or your uterus from functioning properly.
Mhm.
Um, so those are kind of the some of the big ones with endometriosis. And then with PCOS, they can do some hormone balancing. A lot of PCOS is lifestyle
Mhm.
issues. Be addressed with lifestyle issues, not all of it, but some of it. And so they can help with hormone balancing with PCOS. If your ovaries are so polycystic that they're huge, that there's like risk of
Yeah.
torsion, which is when they get so heavy that they can fall and twist, and they can actually die and you lose an ovary. They can there's some surgical techniques, ovarian wedge resection, where they actually go in and cut a whole wedge out of it and stitch it back together. And they have found that that can help restore ovarian functioning for some women. Um, and again, hormonal balancing. So, targeted progesterone supplementation. And if a doctor ever tells you, "Oh yeah, I'll do progesterone," we just do it on day 14 through 28 of your cycle every other day. Run,
Okay.
because they should never be giving you a day of your cycle at which they are telling you to do an intervention. They should know that your cycle is unique to you. They should be looking
Mhm.
at your charts. They should be either they should be teaching you, or somebody who works adjacent to them should be teaching you, a fertility awareness professional, should be teaching you how to read and chart your own cycle. And then they should be implementing hormonal blood draws and hormonal supplementation according to your specific cycle. So none of this come in at day 14, 16, 18 nonsense. It's come in, uh, you know, 2 days post peak, then 4 days
Mhm.
post peak, because your peak is unique to you and you
Right.
should be taught to identify your own peak.
And not
So
just you, it's each cycle, right?
yes,
So,
exactly, and can change, especially if you're dealing with cycle issues. Your peak might change, and be on different days across different cycles.
have you heard any
So
of this stuff? I don't know that there's actual research on it, but,
mhm.
just anecdotes about using GLP-1s to address PCOS?
Yeah, we actually have an article about that at Natural Womanhood that I
You can
can
link
send
in the
you, and
show
you can
notes.
link in the show notes. I think there's a lot that we don't know yet about GLP-1 inhibitors. Um, there's issues with being on them long term.
Mhm.
Certainly losing weight, if you have PCOS and you're overweight, losing weight can be a really, really great way to help um, mitigate or even help start to reverse your PCOS.
Yeah.
But you need to do it safely, and you need to do it in a way that you're still nourishing your body properly.
Mhm.
I would never tell somebody that like losing weight when you have PCOS is the end all be all. You should be cleaning up your diet. And then hopefully when you do that, weight loss will come.
Mhm.
But you just need to focus on nourishing your body properly first and foremost. And I fear with the GLP one drugs that are out there, that again we're not really giving people good body literacy,
Mhm.
good understanding of how to take care of themselves. It's another kind of quick fix.
Mhm.
um, and unfortunately, that is where people are turned off by RRM, and where they see IVF is more of like the quick fix, right?
Mhm.
Because a lot of RRM is we're doing these interventions, and we kind of have to wait and see how the body responds.
Yeah.
But ultimately, you're going to end up healthier because of it. And I think we need to be better at expressing that to people. I was at an event in Washington, D.C. a few weeks ago that was co hosted by the Maha Institute and the Heritage Foundation
Mm.
on women's health and fertility. And a point that I made that I think I just need to start beating the drum on even more is when I was undergoing my infertility workup with a restorative reproductive medicine trained doctor, I actually felt and saw myself getting healthier because of the
Mm.
interventions that he was encouraging me to do,
Mhm.
and because of the different targeted hormone balancing that we were doing. You could see it in my charts, I could feel it in my body.
Mm.
I was actually getting healthier for the infertility treatment that I was undergoing. Can you find me a single woman who has undergone IVF who says she's healthier for it? I I won't hold my breath because in general, I see women whose health is absolutely destroyed because they've from
Right.
undergoing IVF. And so I think we need to hammer that home a lot more is that RRM, sometimes it can be a quick fix. Sometimes all you need is endometriosis surgery by a really good surgeon. And you might never need intervention again, except maybe some hormonal supplementation here and there when you're pregnant.
Mm.
But IVF, you're not going to get healthier, and so maybe that's why we see worse maternal and infant health outcomes with
Mhm.
IVF. Um, we don't really understand why the outcomes are worse, but my thinking is that because the moms are not healthy to begin
Mm.
with, and they're made even less healthy by the extreme interventions of IVF.
Right.
The drugs that you're put on to pump out dozens of eggs at a time, which no female body was ever meant to do
Mhm.
naturally. Having to get on the drugs that shut down and then kind of give you a fake cycle so that they can target when they implant the embryos. And by the way, they do this to surrogates too.
Mhm.
It's the same thing. They have to get the surrogates cycle on track,
Right.
as it were, for the implantation of the embryo. And so um, we don't see women getting healthier as a result of IVF, and I think that's an incredible shame because we want healthy moms
Mhm.
and we want healthy babies, and we want moms who are healthy enough postpartum to be able to take care of those babies and those children. And
Mm.
so when we're so laser focused on we just have to get a baby, we just have to get a baby, we just have to get a baby by any means, we're not thinking long term about the health implications of forcing pregnancies upon women who have all these underlying health issues that have been totally unaddressed with
Yeah.
IVF.
Well, and then the industry really preys on that beautiful desire for parenthood
Yeah.
and the pain of not having been able um, to pursue that to its fullest ends, and the fact that women will then, in that instance, feel a degree of desperation of like, I don't care if it makes me less healthy, if it makes me less healthy, but I am able to be a mom, like that's
Yep.
what I want to do.
Yep.
And there's a lot of money to be extracted from that, and a lot of money to fund advertising and articles and celebrity, um,
Yeah.
I guess PR type stories of look,
Yeah.
isn't this so great? And not a lot behind actually healing women. We're
No.
running up on our time here, and I do want to respect your time, but I did want to circle back to this question of education and talk a little bit about Natural Womanhood's Period Genius program. I'm going through it with my daughter, who's a little on the young side, but she's very precocious, so she'll be prepared. But it's absolutely fantastic. So I would love to
Awesome
hear
too.
um, for listeners, what is the program? What inspired it? And what kind of feedback you're getting from other moms and girls, not just our great experience.
Yeah. Thanks. Can I ask quickly how old your daughter is who you're doing
She's
it with?
9. She's 9.
9.
And
Oh,
I
no,
I mean, I
9's not
started at
too
10,
early.
so
Yeah, it's not too early. Actually, we created our Period Genius program, with 8 to 12-year-olds in mind. And so your daughter's the perfect age because ideally, like I said before, I want a world where no little girl or teen girl starts her period thinking she's dying and having no idea what's happening, right? And unfortunately, that's the world that we live in right now. And so, our Period Genius program is a puberty education program for girls 8 to 12, although we've had moms tell us that they have their older daughters who've sat in on it as they're doing it with their younger daughters, and the older daughters are getting a lot out of it too, because we didn't infantilize anything. We don't talk down to you in the program. It's 10-minute videos that go through the science of the cycle, that go through what to expect in puberty, what a normal healthy cycle looks like, what an unhealthy cycle looks like, how to get help for cycle issues, and all of these different aspects of preparing girls and young women for the life, the embodied reality of being a woman. And we've had really awesome feedback from it. Some of my favorite feedback, I think my very favorite piece of feedback that I've seen was from a mom who said, I am loving and so appreciating the change that I've seen in myself,
Mm,
talking about my fertility and my womanhood and my femininity in a positive way for the first time
mm,
in my life. And so that to me just that's incredible because we need moms to really um, heal. That was one thing
yeah.
that we realized with the research that we did going into developing the Period Genius program was that so many moms are approaching puberty in their daughters from this place of fear because of how they experienced
Mm.
puberty.
Or
They
just the way that you were socialized to think about it or talk
yes,
about it
yeah,
or not talk about it in your family growing up, that
mhm,
it could be hard to even understand, well, how do I approach this, or how do I that's why I thought it was such a good way to frame everything around the beauty of your body preparing for this incredible natural capacity of marriage, of marriage, yes, marriage, but of motherhood,
yeah,
and to be able to talk about that in and to start discussions to open up that line of communication, but to have
mhm.
that solid foundation to start from is really beautiful.
Yeah, and it's I think what's really unique about it is that it's evidence-based, and it's really taught from the standpoint of, this is what your body this is what your body does, and
Mm,
it's a good thing. This is a sign of health. This is why you're developing breasts. This is why you're developing hips. This is why you're going to bleed and why ovulation is so important. We really get into all of that so that, it can be such a disorienting time when you're a teenager to have all of these things happening to you and having no context for it.
mhm,
You are developing breasts, you are developing hips, so you're competing differently in sports, and that can feel unfair. And you're attracting the male gaze in a way that you never have before, and that feels a little bit scary. And if you don't have the context for no, this is all geared towards you being able to conceive and carry and nourish a new life someday.
mm,
It can feel like, oh my gosh, why is this happening? I hate it. I don't understand it. It's scary. Why do I have to undergo this? And I think it's a big reason why we're seeing women just run so far in the opposite direction of embracing femininity,
mm,
right? To the point where we have scores of girls saying like, "No, I'm actually a boy. I don't want to do
mhm.
this
Yeah.
girl thing." And so I think it's really powerful when we can contextualize the changes of puberty as being all geared towards eventual motherhood someday and the
Mhm,
gift that that is. And then also letting them know that if you are having problems, those are real, those are legitimate, and they need to be taken care of
mhm,
in a way that protects and preserves your fertility. Doesn't just deal with symptoms and shut everything down. Because that's the other aspect of it too, is right that women just feel so lost. And I think moms feel so lost when it comes to getting their daughters the help that they need. And so our Period Genius program gives moms the script. And it's not just for moms. We've had some dads do it. We've had grandparents do it with their kids and grandkids. Um, it gives you the tools that you need. You don't have to be an expert. You don't have to
mm,
teach a fertility awareness method yourself. You don't have to, be a trained gynecologist. We actually have somebody who told us like I think she was an OBGYN and an RRM trained OBGYN, and she said, I know all this stuff, but the way you guys condensed it
mhm.
down for my daughter and presented it in this just engaging and informative and age appropriate level, she's like, I never could have done this.
Yeah,
Um,
sometimes we know too much to articulate it
exactly,
properly,
it's in a
digest
way
it.
that doesn't make your kid feel like they're drinking from a fire hose,
Yeah, exactly.
And so I think our program does that really well, and especially if you do, like, 1 10-minute episode with your
Mm,
daughter a week for 10 weeks or maybe a couple at a time, and then
Yeah.
give yourselves time for discussion after it. And then we have some other supplemental materials to different suggested activities that you can do that go along with the different videos. But we're really, really proud of the program. And we actually have a really good promotion going for July. I don't know if this episode will still
Ah,
air,
It
but
it will be
we
in September.
okay. Well, we do occasionally run some promotions on it, and it's not very expensive even at full price. And yeah, we've had such phenomenal feedback, and I'm really really proud of that program and the change
Yeah.
that's happening in individual girls and moms' lives
Mm,
because of it.
yeah. I wish we had more time to keep talking
Me
because
too.
so much to say and so many more questions, but we are out of time. So one final question that we're asking all our guests, that I am asking all of our guests, is who is one person, alive or dead, real or fictional, who you believe exemplifies the very best of being human?
um, I really really love Emily Chapman.
Mm,
The writer, she's got a great Substack called Through a Glass Darkly.
yeah,
Um,
I've subscribed to. I love it.
yeah, it's one of the only Substacks I pay for, which should say something, because she's just she's so good. The way she delves into different issues around faith and around family and even food, like everything that she
Yeah.
talks about, she does it from such a measured um, perspective, both understanding the ideals that we're striving
Mm,
for and the human brokenness that we all carry that makes it difficult, yet encourages you to still pursue the good
mm,
every way that you can. I feel like every single article I've ever read by her and every book I've ever read by her, you can really sum up in
yeah.
that way.
For
Um,
for podcast listeners, I of this podcast, I really appreciated her comments on Brian Johnson, who is trying to live forever and sacrificing everything that makes life worth living in the process. That was a great post. I don't know if that was a public or paid one, but we
Mhm.
also had Emily on the podcast in season two. She talked about embryo adoption. So, what do we do with the leftovers from IVF
Yeah.
that are going to be discarded, frozen indefinitely? So, that if you want to hear about Emily's infertility journey, process of discerning adoption, and how she thought about the moral question of and thinks about the moral question of embryo adoption. There's
Mhm.
that episode to listen to also.
Yeah. So she's just great. I think she came to mind after thinking a little bit about that question because I do think she walks the walk too in her home life. Been fortunate to meet her just once or twice, and you can just see that she is who she says she is. She doesn't, and she's kind of something of an influencer, right? But she's very unfiltered. She's not trying to put on airs
Mm,
and um, yeah, so I really love her, and she's who came to mind to answer that question about just being human.
excellent. Thank you. I'm sure she will be tickled and probably a little embarrassed to hear.
Probably, yeah, because she's very humble, and
Um,
I girl over her a lot.
so, how can listeners support this movement, either publicly or personally? And how can they find you, your work in natural womanhood?
Yeah, so I am the editor in chief of Natural Womanhood. You can find all of our resources, all of the content we put out at naturalwomanhood.org. And I also host the Natural Womanhood podcast, which you can find across all of the different podcast platforms. Um, and yeah, that I write. I do some freelance writing in different outlets as well on occasion, but for the most part, my main gig is being the editor in chief for Natural Womanhood. That's where my passion lies, is in the work that we do there. And from the educational content, like the Period Genius program that I talked about, to the articles that we put out. We do 3 brand new articles around women's health every week, and I edit all of those, to yeah, the podcast and everything else in between. We're really committed to the ideal that every woman can learn to know and love her fertility, and to see it as beautiful, powerful, and healthy. Yeah,
Excellent. Well, thank you so much for your time and the conversation. It's been fabulous. Thank you.
yeah, it's always so good to talk to you, Samantha. Thanks for having me on.
You too.